many of you know, if you've been here before, we sponsor occasional dialogues with anybody who comes into town, or topics that our customers suggest, or things that people want to talk about. We've been doing this off and on since October of 3 years ago. I guess that would be 2012, and we've had some great conversations. These will be later on YouTube under Fair Grinds YouTube channel. You can see any of the past dialogues. Gary Delgado has been a organizer, researcher, scholar, and activist in every way you can imagine for 40 years or more. I first met Gary in Arkansas. Well, I first met him in New York, and then he worked with me in Arkansas in the early days of Arkansas Acorn, and then came back again. Plenty of seats over here. You can see better, hear better, everything better. And then also spent time helping Acorn and its platform process as its members tried to figure out if they ever had power, what would they do? And out of that came a seminal book that Gary wrote called Building the Movement.
Close. Organizing the movement.
Organizing the movement. You know, you can't have it all. Roots and something of Acorn, something like that. So, you know, Gary will speak to that. But knowing he was in town, you'll hear what he's been doing and some of his associates. We asked him. He then went on to found the Center on Third World Organizing in Oakland, California, and later after that, the Applied Research Center, where he's done amazing work in looking at the impacts of community organizing, race, and whatever. Arguably, the Center for Third World Organizing has done more to promote a more diverse community organizing, labor organizing practice than many things that we've seen over the last 40 years. So Gary happened to be in town, so the quid pro quo was, we want you to do a dialogue and see what's on your mind. He's got some stuff he wants to show, some tricks up his sleeve, and then we'll talk as we do in these dialogues about anything that he wants to talk about, that I want to talk about, any questions you have. The only rules we ever have once we get to the discussion is that everything's over by 9. You know, years of running meetings. Once they go too long, people just get dangerous and ornery, and you know, we just don't want people starting to fidget and sneak out because they think it's not going to. We run a tight ship. So come 9 o'clock, if we finished early, we'll finish early, but we won't go later than 9, just so you know. Gary, welcome to Fair Grinds.
Thank you. This is small enough. Why don't we just go around and see who's here, right? Can we start with you?
I'm Nikki, and I live here, and I heard about this thing like an hour and a half ago, and now I'm here and I'm listening to all the cool stuff. That's it.
Good.
I'm Nathan. I'm a student in Philadelphia right now, but my research is here, and I used to live here.
What is your research?
Studying media and environmental hazards here. And then last summer I did a field school that focused on participatory action research and race and health disparities. So there's a couple ways in which I was drawn to the flyer.
And the flyer says race, you know, it's got everything in the sun, so. It spoke right to Nathan, it sounds like.
It's Marcel. I'm just beyond. I'm Kevin with the NAACP, SCLP, Fresh Out, Culture, and my paper 7 8 other different organizations.
My name is Shauna Begar. I'm a member of Community Education Project of New Orleans. I am also Native New Orleanian, born and raised. And I do a whole bunch of stuff around education, justice, work, and housing, and all the other stuff that you have to do if you're an organizer in New Orleans.
I'm Beth Butler with a Community Voice, a lifelong community organizer.
Chuck Rathke, Assistant Manager for Fair Grinds Coffeehouse, just here to listen to this event?
I'm Taman Scare. I'm an intern for Gary. We're doing a national survey on Medicaid expansion. Here with the team.
I'm Susanna Balusi. I'm an Argentinian lawyer, and I'm here for the summer. And I'm volunteering at the Workers' Center for Racial Justice.
Great, and as I said, Wade Grafke with Fair Grinds, and obviously as well a community organizer with Acorn International, Local 100, whatever.
Ana Villanueva, I'm in California. I go to San Francisco State. I'm also working with the survey that Gary's doing and turning over the summer, and I'm a vice president for the Research and Empowerment Center for the Ethnic Studies Department in San Francisco State.
All right, a formidable crowd. So I think I got panicked this morning when I saw the flyer. Wade sent it to me, but I didn't really read it.
Oh, then you bought that lesson.
So here's what I think might make a little bit of sense, and see if you're with me on this. I'm going to talk just a little bit about, I've actually done, as Wade has mentioned, a couple of different things. I've been an organizer, I've been a trainer of organizers, I've been a researcher, I've been a filmmaker, and I'm going to talk about what that has to do with the evolving notion of racial justice and why those different points of entry at different times have made sense. So let's start off first with the organizing. Both Wade and I were part of a large national movement prior to Acorn called the National Welfare Rights Organization. This was an organization largely of women and of women of color. And one of the things that it was quite a militant organization, and we were able, over a fairly short period of time, to really organize people around material self-interest. So the most famous kind of campaign we used to do in those days was called a furniture campaign. What that meant was people were entitled to, on the books in many states, basic human needs. So people would organize around those basic human needs and fight for them. So it would say on the books that poor people were entitled to a refrigerator, poor people were entitled to, a stove in their house, people were entitled for a bed. And when we first started organizing in Arkansas, people didn't have that stuff. And so there was a protracted campaign, and Wade had done those campaigns in Springfield, Massachusetts, and I'd been involved in those campaigns in Washington, D.C. to get people the stuff. And we usually, because at the time, we usually were able to win those campaigns. We were usually able to actually force the government to do what it claimed it was, it was going to do. Now remember, this was the tail end of the civil rights movement. And so we had the momentum of the civil rights movement at our backs when we were attempting to move these kinds of campaigns forward. And the organization, though somewhat multiracial, was largely African American. At the time, it wasn't African American, at the time it was black. All right, it was a black organization, black women, in the leadership of the organization. And people were able to move the agenda in the face of a critique from organizers around the country that said these people couldn't be organized because they're poor. These people couldn't be organized because they're women. Now I understand that sounds weird now, but at the time, the notion that women could be organized, even on the left, not just in terms of right wing people, they organized that poor people could be organized. That was a new and different concept. Now, moving forward a little bit, Acorn was an organization that reconceptualized the notion of organizing. It reconceptualized it in a number of different ways. The first was, it didn't just organize a constituency of people who were on welfare, it organized a constituency of poor people, which included black and white people. And at the time, in places like Little Rock, Arkansas, which is where Acorn started, that was a complete novelty, right? It was a complete novelty to have white people and black people in the South in the same organization, not marching, together, but in the same organization, fighting for the same thing. That was a new thing to think about, and it forced us to really rub up against what was the importance of issues of class on the one hand and issues of race on the other. It forced us to really think about what that meant. And in the early days of Acorn, Wade sort of insisted. There was a mandate from George Wiley, who was the head of the National Welfare Rights Organization. It was going to be a multiracial organization. So moving forward in that organization, both times I worked for Acorn, both in 70, 71 and in 79 and 80. One of the things that became clear to me was that although we had a very good analysis about class, we were reluctant to actually put forth a sophisticated analysis about race. And so, and sort of my own personal journey at that time was, I had organized in Arkansas. I went back to welfare rights. I was a head organizer in New York, and I then started an independent union in New York, actually called the United Rep Workers. And so I had a bunch of different organizing experiences, and I kept getting told by people from the left that I didn't really understand. The full, notion, sort of what was going on in the world. So these were mostly white people who were telling me this. So I decided, I was going to go to graduate school. I was going to find out. I was going to find out about that, what that intersection was of race and class, and be able to talk about it, and be able to be explicit about issues of race. So went to graduate school for a few years, thought I got some of that stuff, and then in 1980 started the Center for Third World Organizing. Now the idea about the Center for Third World Organizing were a couple ideas. One was we actually, and I am from New York. A lot of people think I'm Latino. I'm not. I'm Afro-Caribbean. My people come from Jamaica. And so in New York, there were good relations between blacks and Puerto Ricans. I mean, we worked together on a lot of issues. I went to school with the Black Panthers and the Young Lords. When we started the Center for Third World Organizing, we said we needed to be able to have an organization that embraced the organizing traditions of Latinos, blacks, Native Americans, and Asians, but we didn't know anything about them. We did not know, and in the community organizing sort of world, they denied those traditions. So Native Americans at Wounded Knee, they weren't organizers, they were something else. Folks who put together the Brown Berets in Texas, or the Young Lords in New York, they weren't organizers. When Jose Angel Gutierrez put together the Crystal City work, which was some of the most interesting electoral work in Texas, they weren't organizers, because community organizing was thought about in a very particular way. And we wanted to try to, A, bust out of that, and B, we also wanted to know, like, I was like, I'm from New York, right? So like, I always wanted to know, like, why were those Native Americans always organizing about what I thought was ecology? right? I had no understanding of their relationship to the earth, how people thought about spirituality, or any of that stuff. I didn't know about the brilliant electoral work that Jose Angel had done in Texas. I knew very little about the Brown Berets in Texas and what they had done. So one of the things we did in the early days is we just got people who were part of those movements to talk to young organizers about what they did and why. All right, what were the theories that motivated them? These are people from the Civil Rights Movement. These are people from AIM. These are people from the Black Panthers. We had them all. All right, not that anybody was right or wrong, but we wanted to legitimate a series of traditions. That there were traditions that came out of our communities that were traditions of fighting, traditions of resistance. All right, so that was the sort of the impetus to really inform young organizers who had different things to deal with if they were in New Orleans than they were in New York. All right, different things to deal with than if they were in the barrios on the border of Texas, or if they were organizing, on the plains of Montana. Those were different environments that organizers had to go into. We wanted people to be able to at least know, all right, why it was that, for instance, Native Americans in Montana are destroying, trucks today that are trying to build a pipeline. All right, why, what is that about? Why are people why are Latino folks in California and in Texas in deep resistance to the Migra? We wanted some cross intellectual work. So over some years, what we would do is we would place people within in organizations. We didn't abandon our connection to community organizing, because one of the places we placed people was with Acorn, but we also expanded it. People worked with unions, people worked with Native organizations in Montana, people worked with farm work organizations in Texas, and learned a little bit about how people build social movements. So the way in which we talked about race developed over time. We wanted to be explicit but not exclusive. So explicit that race is an important factor when talking about organizing work, because race is related to culture. In this country, all right, how people see you defines you. So you have to be able to understand different dimensions of race and culture. So that was one important thing. But we didn't want to be exclusive, because we wanted to also understand that race was not the only mode of oppression. There was class, there was certainly gender, there was, in our understanding of, LGBT issues evolved, as did everyone's, in the country over time. So I don't want to make it sound like we knew, all that stuff when we started out. We just knew we needed to understand more than we did to be effective doing the work. And to give you a couple of examples, we worked in the Justice for Janitors campaign. We worked in a number of the local, campaigns that Acorn did in New York. We worked in the housing, in the housing campaign there. We worked in some of the work that was done in California. We worked with the farm workers in Texas. We actually, have sent people to organizations in New Orleans around the recovery. So we tried to actually get our people exposed. Now, why is that? Why is that? Well, it's partially because we believe that even though we recruit people to become organizers, not everybody will be an organizer, all right? And we believe in the notion of what gets called an organic intellectual. We believe that people need to learn about what's happening in the world by coming in contact with it and by interacting with it. So we were trying to develop people who could operate in a number of situations. So I'll give you a couple for instances. The head of what gets called Race Forward, which publishes Colored Lines magazine, a map grab. The head of the ACLU in California, a map grab. The former legal counsel for La Raza, a map grab. The former mayor of San Francisco, a map grab. So what we developed were a lot of different people with an awareness of how to move the political system. Now, and what they had in common was an understanding of race. All right. Moving a little further, and I'm going to just, I heard you all talking before about disproportionate suspension rates in the school. So I got antsy after about 10 or 11 years of doing that work, and I did have I had a PhD, so I was like, I should use this, and decided that the other thing we needed, besides just being able to put boots on the ground, is we needed something that the right had, which is called intellectual ammunition. We needed to be able to write, we needed to be able to document, we needed to be able to give groups on the ground the ability to move because they had intellectual ammunition. They had the data, they had an analysis that enabled them to influence and fight around issues of public policy. So probably our most significant contribution at the Applied Research Center was in the 96 fight around welfare reform, where everybody in the country was talking about what a good guy Clinton was, and I happen to think that the worst thing that happened to poor and black people in this country was Bill Clinton. And the welfare reform took every single thing that Moynihan's racist book about the black family wrote and turned it into a piece of legislation pushed by a so-called liberal Democrat. And when he passed that legislation, that's when you got time limits. You can't be poor for more than 5 years. Because if you're poor for more than 5 years in a number of states, your time is up. You're cut off. All right. You're over. All right. And despite the fact that more than 60% of women on public assistance had been in some relationship that was harmful for them with a man, what the right was proposing and our comrades on the so-called left were going along with was that they should get married. There was a thing called the marriage initiative. So what they were encouraging women to do was they should get back with men who had battered them in order to be able to have the family. So there were at that point very few organizations, as there are now, willing to fight around those kinds of issues and to call out some of the very clear sort of policy decisions that were putting particularly poor women in a situation that was not really good for them. And so at that time, we aligned with a number of organizations and attempted to sort of take them on. The one thing that I would say came out of that fight was not a win in terms of welfare reform. But what did happen is the big sort of DC organizations now all have racial analyses about what happens, about what happened under welfare reform and what the racial implications are. And I do think actually that is important because race was not on the table at all when they initially began talking about it. So that sort of sets the table. I'll say a little bit about film later, but I'm going to stop here and just pose a question. We are currently involved in an experiment around healthcare. And I heard you all talking about your own experiences in healthcare when I walked in terms of the ACA. What does race have to do with healthcare and healthcare reform?
You mean the people who made the decisions around how the program would work and be funded were disproportionately upper-class white males and were not affected by it. And the people who are most adversely affected by it are lower income, mostly women, people who are disabled, and people who are poor.
So there's clearly
People of color.
there's clearly decision makers. What else can you say about race and health law? What else?
Well, I mean, just like with any other system, if you're poor and you're black, you're gonna, or Native American, I'll say that from Louisiana, you're gonna get the bottom of the barrel treatment. For instance, like your employer doesn't understand because he has another tier of health care. Because his tier is higher, he gets to go to the doctor and be seen within an hour and a half. You know, like he was on his lunch break. Where you who are on the bottom tier are gonna wait 6 to 8 hours to see another doctor, because the doctor he's seeing is not gonna accept your health insurance. And the health insurance you're gonna get is gonna look very different, because the poorer you are, the lower your tier, the more expensive your medication is, the more expensive your copay is, the less things that they pay for as far as tests and diagnosis, and it's probably the more you need them, because you're not getting the other things, the preventative side. So I mean, it's still that trickle down system, and then you have the other thing. You have the whole doctors and their whole the racist, classist stuff the doctors do about not giving poor people pain medication, not really diagnosing them, assuming that they're there to get off work or overtax the system.
The brother in the appropriately clothed red shirt. What about disparities?
Yeah. Yeah, I don't really know much about the Affordable Health Care Act and how it's affected the health disparities, or how it will affect health disparities. It's actually kind of what I was hoping to hear about tonight. But yeah, health disparities, access, like you were talking about.
Okay.
Different conditions that are racialized, health conditions that are racialized, like hypertension and diabetes, due to so long-standing legacies of racist social policy.
Anybody else want to throw down on this?
To that, I'm an intern. I'm from Milwaukee, so I have a new experience going to the West Coast, and when I'm in California listening to the radio, one of the advertisements from the California's Board of Health talks about, it's geared towards African Americans, and it's this African American woman with some sort of music that's supposed to be geared towards African American people, saying that there's long-standing traditions of certain types of food in our culture, but that has led to a lot of disparities, including diabetes and amongst other health issues. And they're creating some sort of, a plan, a place that you can call or contact to try to create a new legacy, as it says, of building a new culture around healthier ways of living. Because in all reality, a lot of food, although it may be very good, soul food, equally so with natives and fried bread and whatnot, these are there because these are the scraps that were given because of certain racial disparities in the past and social, legacies that have been carried on for hundreds of years. And because of that, we're now in a current system that is affected by that very much. And a lot of people of color and just in impoverished situations have to face these different health issues simply on the fact of that's what they're given.
I'm sorry, I know I already talked, but I have to say something because I'm so tired of that stereotype, bull crap, dogma crap, and that's what it is. Because McDonald's is way more unhealthy than my grandmother's gumbo. I'm so sorry. And as far as us living on the scraps, yeah, it's called America. We've been living on scraps, period. A lot of what's making people sick as far as hypertension, diabetes, and everything, it has little to do with the food. Because my great-grandmother and my great-grandmother before them, who lived to be 90 and 100, ate the same food. But it's the economic structure. So like my great-grandmother and grandmother had their own farms, and they had their own land. And they had a system and a way of living. They had their own. And we don't get to have that. That combined with all of the racist just stuff you have to swallow every day is gonna have an impact on your health. The fact that I don't have good school to send my child to, the fact that I have to wait at the doctor for 6 hours, the fact that I sit on a streetcar and I can have a seat next to me and 30 white people will stand up and not sit next to me because black apparently is contagious. All of that, every day you're swallowing, is gonna have impacts on your health. The fact that after I had a C-section, my doctor gave me 15 pain pills, and a lady next to me had a bunion removed and got 60. You know, so if you're constantly just swallowing this, it's gonna have impacts that impacts your health. People wonder why black women have premature babies. It is like crap that you hear every day. I was at the store and a woman said, oh, these black children are raising themselves, it's a shame. And I said, you're absolutely right. That's been going on for like 100 years now. She was like, yeah. I said, because my great-grandmother was busy raising white folks' children, so she couldn't raise her own. And then everybody looks at me stupid. We don't know how to parent, but up until like 50 years ago, we were the people raising everybody else's children. So it's dogma bull crap. That's what it is. But they want us to believe that everything about us, our culture, our way, and our way of being is bad. Now, I'm not saying that pig feet are good for you, but at the same time, I bet you that pig feet is better than you did that McDonald's Whopper or whatever it is. And that's why I just have to say that. Because
I'm happy that you said that.
Well, this is a very pregnant discussion, particularly in New Orleans, where we had a healthcare system that, in some way, minor way, did pretend to give services to poor, to black people, the charity system, best of its kind of country. It was demonized by profit makers who wanted to get that money. And they squeezed it. Each year we had to fight for appropriations, sometimes organizing sneak attacks on whoever the governor was, put money back in the budget. They were taken out. And then Katrina came. They had a plan before Katrina to build a new hospital. And it was very suspect of that. But Katrina happened. And a perfectly good hospital did not sustain much damage. It was trashed.
You know a charity?
Yeah. It was trashed. The National Guard put back in there under the Army's direction and totally put it back into place. Officials of the state refused to let any of the people go back in there. Now, what happened in the meantime? The people who suffered were either without health care. They went to the private providers who did not understand it. They didn't speak that language, another culture. And a lot of them got misdiagnosed, stuff. And a lot of people refuse to come back to the city because they couldn't get health care. Now, that's, the racial dimensions of that are very important. If you ever walked from Charity, you saw a sea of black faces, a sea of poor people. There were no affluent people in Charity. So, the changes that happened, they impact people of color far greater way, black people, African Americans, far greater way than they impact anybody else. So, you know, as you look at healthcare, African Americans, it definitely has its racial dimensions. And race probably is the most important consideration when you look at people who have and who do not have healthcare, at least in this day.
So there's a study, a field of study called epidemiology, which looks at what are all the factors that contribute to a particular health situation, a lot of which you talked about. I'm gonna go back in my own personal history just for a second. I was telling Beth this morning, my people come from Jamaica. My great-grandmother was what was called an Obeah woman. What? Obeah. An Obeah woman, a medicine woman, is a woman who collects, herbs and would cure people. My daddy always talks about, yes, mom, she cook up some mush, and we drink it. We have to drink it, that knowledge was in, under our control, was in, and was in my family. But colonialism stomped that out. The Catholic Church stomped that out, all right? Because that was witchcraft. Then we go to the next generation. My mother was a public health nurse. She started out as a public health nurse, and they don't have them anymore in most places. A public health nurse, what she did is she used to go out into the community, and she used to do exams. They used to give out vitamins from, this was in New York City, from the city. They used to be able to then get people in to see doctors, get them to checkups, make sure babies were. That system was eliminated. Keep it up with my mom. My mom went and got, she was actually one of the first black physician's assistants in New York. She became an administrator in a mental hospital called Hoag Psychiatric Hospital, where the clientele, it was on Long Island, clientele was mostly black. In the 70s, what did Reagan do? Reagan closed down so all the facilities one thing that I know is common to a lot of people in the room is we have all these homeless people. We did not have all these homeless people because a lot of homeless people back in the day had mental disabilities and they were taken care of by the state. All right? When those places got closed down, that was in many cases, you all have heard the term NIMBY, not in my backyard. Yeah. Right? Well, that term actually became very popularized, at least in New York, around no, you can't dump those mental patients in what was called single room occupancy hotels in, you know, other kinds of neighborhoods. We had systems, we had infrastructure, as Pat was talking about, that actually looked after people. We valued, you know, the ability. I'm not saying this was, you know, this country was, you know, great, terrific, whatever, but we had a lot more then than we have now. And the system is consistently being eroded. Now, that doesn't get past the question of disparities, because it's as the sisters pointed out, it's not just that we have to wait longer to see a doctor, all right, who then talks down to us. It's, you know, and I was gonna like take us through a little quiz today about it, but it don't make no sense to do that. I mean, we are misdiagnosed more than anybody, because we can come in with the same, you know, with the same description of disease as our, you know, as Anglos, and we won't get the same diagnosis. When we are diagnosed, we don't get the same treatment. We don't get angioplasties, the same as white folks. We don't get pain medication. It was one of the things on the quiz, was like the true or false. Black people get pain medication 20% more than white people. Wrong. We actually get it 50% less in terms. So it's not only a system, all right, for which there is no infrastructure. The very captains of the system, in terms of the doctors that everybody is supposed to trust, have, you know, individual, you know, bias, which makes us in a situation where we're sicker, all right? We're exposed to more in the environment, all right? I'm not just talking about black folks, all right? I'm talking about, this is poor folks, all right? This is people of color in general. We are exposed to more, and then the system, all right, puts us in a situation where we get misdiagnosed and we get less medication. Now, so when we have the Affordable Health Care Act, all right, there's one small part of that system that's supposed to be changed. What is it? Anybody know? Huh?
Can you repeat that?
What's the one thing that the Affordable Health Care Act is supposed to do?
Like access to insurance.
It's supposed to give us access to insurance, all right? Does it give us access to affordable insurance? No, it doesn't give us access to affordable insurance. Let me just ask folks. So y'all have been interviewing people on the streets, right? Mm-hmm. All right. When people, you know, have supposedly access to insurance, how long does it take them to see a doctor?
A long time.
Like some of them, like 2 months. I heard a couple was like over 5 months. A lot over 2 weeks. You know, so it's not like it's. And some of them it started. Obamacare came in what month, and they still have not seen a doctor. Like they got it, they know they have it, but they still have not been able to like go see a doctor or have their own doctor yet.
One of the things that I've been finding a lot is there's people who have tried a lot, and the system is being overused compared to what they were expecting. So a lot of people are, even if they are getting coverage, they're not getting the care. That's a real big problem, where people are not getting the care. And then it's a two-sided issue too, because then there's other people who are getting higher health rates, and then they're against Obamacare, and it's really there's a lot going on with that, but it's a lot of lack of care being provided, and the coverage that it's getting is a lot more expensive for some people. Only the poorest of the poor, I feel like, are getting access to this Obamacare and actually getting a little bit better health care, but that's simply because they had no access at all in the beginning. But a vast majority of the people that we're interviewing are not getting that care at all.
So let me give you a parallel situation in the education field, all right? In California, in the early 2000s, the state legislature decided they wanted to do something about at-risk youth. Now, at-risk youth is a euphemism for
Black males.
Well, there's also Latino.
No,
In
Latino.
Yeah, in California.
California is
Like Latinos, I'm sorry, I should
But
have
it's,
said that.
but it's not just boys. It's basically kids of color. Young people of color, right? So what they decided to do was they decided to pass the class size reduction act, all right? So they passed the class size reduction act with by the way, with good intentions. They had good intentions, all right? And the class size reduction act passed, and they allocated the money in one pot, all right? And how were school districts going to get the money if they wanted to reduce their class size?
Based on attendance.
It was a first come, first serve. First come, first serve. So who got that money? The rich schools, all right? The rich schools. Now this is where y'all know the song, good intentions just ain't good enough, right? The rich schools got the money, and places like Oakland, where I live, a year after they passed that act, the rich schools got the money. What did the rich schools then do with the money? They reduced their class size, right? And what did they then do?
Push out the children of color.
Huh?
Push out the children of color.
No, they didn't have no children of color in them rich schools. What did they do? They hired teachers. They hired teachers because they had extra slots, right? Where did they get the teachers from?
All the teachers who are teaching people of color.
All the so-called cream of the crop from the schools in my town. And so what happened a year and a half after they passed the class time reduction act, we had a teacher shortage in Oakland, all right? So what they failed to have, and what I would argue the affordable health care fails to have, is an analysis of race. If you don't have an analysis of race and the way race operates, all right, then you can have good intentions and still give all the money to the rich white folks. The Affordable Health Care Act equates coverage with care. Coverage is not equated with care. They're not the same things. But that's the equation that we're operating under in terms of trying to sort of deal with this. I will shut up now. Wade, you want to say something?
Well, I just think it actually is more fundamental. If you look at the vast number of states that didn't expand coverage of Medicaid, these tended to be Republican governors who believed there were no votes to get this way. If you don't believe you're ever going to get lower income, Latino, African American votes, you've got no real political constituency that says, why should you do that? And if that was a Republican governor in Pennsylvania, which normally one would think would be a liberal, state, well, no, you fight it. You try not to do it. In Arkansas, for example, where they expanded Medicaid by one vote, they did it this last time and they extended it for another year on the condition that there be no advertising to people that you could get affordable care. So yes, we'll expand it one more year if you keep it a secret. And that's essentially how they got, and we were glad they got the vote. We're working and organized in Arkansas, but there's nothing about the Affordable Care Act that doesn't interfere with race in that sense, because that's why it's such a huge political fight. That's why the Republicans have tried to vote it down 40 odd times. There is no constituency among the base of beneficiaries for them to expand care. And now we have two decisions by competing federal appeals courts that ruled today. One saying if it's one of those 35 states where the governors, stood in the hospital room door this time and said, no, we're not going to expand, like Louisiana, like Bobby Jindal, then the federal government can't subsidize low-income people in order to be able to get the affordable care. Now, one court says you can, and one court says you can't, and whoever's a betting man or woman can try to guess how the Supreme Court might rule on this. But this is a huge, huge issue, and it all has to do with, as much as anything, who's going to win and who's going to govern for whom.
And a really interesting thing about this fight is it goes to their economic disadvantage. So Texas is estimated to lose 9.58 billion. Virginia, North Carolina will lose 5 billion per day, and Florida will lose 5 billion in 2022. Georgia will lose 2.8 million. So this is a diseconomic decision because they're not getting. And in every one of these states, it's very interesting. The state legislatures are opposing the expansion of Medicaid, but you know who's for it? Chamber of Commerce. Chamber of Commerce, we were just in Idaho, out of the Chamber of Commerce. We interviewed the head of the Chamber of Commerce. He's for it. Because because they're desperate and for jobs. So the economic activity will really help, but they are dead set against anything that will approve of a black president. All right, so they are. I mean, it's like, and when we interview people, here's the other really interesting thing. When we interview people, we do a couple things. We interview people who are sort of involved in the expansion of the ACA, and we also interview individuals on the street. So we've heard all kinds of comments by people about Obamacare. Anybody want to share some of that? What do we hear about Obamacare?